Hi, my name is Dr. Steve Ferrucci, Chief of Optometry at the Sepulveda VA, as well as Professor at the Southern California College of Optometry at Marshall B. Ketchum University. For years, one of the main focuses of my practice has been taking care of patients with macular degeneration, making sure those with advanced disease get the appropriate treatment, as well as counseling patients with mild to moderate disease about what they can do to help slow down the progression of their disease. That's why I'm really excited to be a strategic advisor for Visible Genomics, as well as partnering today with your company in order to take better care of our patients with macular degeneration. The mission of Visible Genomics is to bring a strong solution to enhance proactive AMD management through the offering of genetic-based risk assessment. Visible Genomics offers two separate tests for patients, a lifetime test and a progression test. The lifetime test is targeted at patients who are generally younger, generally less than 55, who have a strong family history of macular degeneration or other risk factors for macular degeneration. This test will predict their lifetime chance of getting macular degeneration. We can then use that information to individualize treatment for these patients based on their individualized risk. The second test is the progression test. The progression test is aimed at patients slightly older, generally 55 or over, that have some early signs of macular degeneration. This test will predict their chance of getting advanced macular degeneration and subsequent vision loss over the next 2, 5, 10, 20, or 30 years. We can then use that information in order to tailor, again, our treatment for those patients. Both tests incorporate non-modifiable risk factors, such as genetics, age, race, and sex, as well as modifiable risk factors, such as smoking status and body mass index. Both tests are used the key findings from the ARED study as well as newer studies in order to get the best assessment for our patients. So in my mind, the way to use this test is like this. If you have an older patient that has the signs of macular degeneration, I'm going to run a genetic test on that patient. I'm then going to use that information to tailor my treatment for that patient based on their specific risk. So if I see a patient with relatively mild to moderate macular degeneration, but I run a genetic test and they're found to be at very high risk, I might see that patient a little more frequently than I would otherwise, perhaps every 3, 6 to 9 months, depending on their clinical picture, in order to help slow down the progression. And if it does progress, I want to know as soon as possible that it does progress so I can take the appropriate steps. That way, we treat every patient individually rather than every patient the same way based on their individual risk. Genetic testing is good for the patient. It's also very good for your practice. It can provide an additional revenue stream for your practice that perhaps you weren't utilizing previously. If you'd like to learn more about genetic testing for your patients, please contact Visible Genomics at sales@visiblegenomics.io. Thank you.